So how is this important? So we'll talk about that here in a second. Also, the duty occupational noise exposure list. So I'm pretty sure, I'd have to go double check it. I'm pretty sure that's a moderate for 68 whiskeys or 91 series for noise exposure. So that doesn't always apply. Let me jump off this screen share. So that doesn't always apply because, like for me, when I was a medic, even though it might be moderate, I was in aircrafts all the time because I was jumping out of airplanes, right? So when I was in Fort Campbell, we were around rotary wing aircrafts all the time. So it all just depends on your particular experiences. I mean, you could be a 42 Alpha, right? You could be like an admin person, and based on your occupation, like where you're stationed in some of those circumstances, it may be a little bit different for you when it comes to noise exposure, okay? So how is this relevant? So if you have back pain, right? If you have knee pain and you're able to say, well, as part of my duty, like from this MOS Smart Book, you can see that I was required to occasionally push and lift 180 pounds and carry it long distance, et cetera. And you can say, here are some examples of how I had to do that. I lifted and took patients in and off the bird when we were deployed or in training environments. I was constantly crouching and bending, having to do that. It was a requirement of my job, et cetera. So I hope this was helpful, and please drop some comments, y'all. If some of y'all have different MOSs that you'd like to hear about, we can certainly do this exercise again. And I hope that you guys like and subscribe. And as always, thank you for watching. Oh, also my disclaimer, I'm not an attorney. I don't know if I threw this one out there already, but I'm not an attorney, a claims agent, or a BSO. I'm just a medical professional that assists veterans with medical opinions for their cases. You can also get those for little to no cost from your treating provider. And I hope this was helpful. Thanks again for watching. Talk to you.